Hi, today we're going to have a live training so you can see exactly what happens when you come in for training. So I'm going to invite my student in. Val, come on in. So Val has brought in her model, Jeannie, and Jeannie has been nice enough to volunteer her face for Val to train on. Now, something very important here. You want to bring in your own models if possible, because chances are a model will become your client. It's a great way to show somebody how nice and effective the microcurrent is. Okay, so let's get started. We like to place a bolster under the knees to support the lower lumbar. You're going to ask your client or your model if she'd like a blanket or not. So, Jeannie, would you like a blanket? Yes, okay. So we're going to cover. We want to keep our client as comfortable as possible. Okay? So, Val, you're going to take your probes. Now, we already have the cotton tips in the probes. These probes allow the microcurrent to come in 6 ways. So the face is not just getting an indirect one-to-one current passage, it's getting 6 ways of a transmission, so it's 6 times the amount. Dip into your collagen and make sure your probes are nice and wet. When you hear the beep, it's time to go. So you're going to start in the middle of the bottom half of Jeannie's chin, and you're going to hold 1 probe still, and you're going to glide for 6 beeps to the right. So Val, we don't hear the beep. It tells me that your probes aren't wet enough. So please dip into water. Okay. You hear the beep and start again. Place the probes in the bottom half, and now for 6 beeps, glide 2, 3. You're going to come to the end of the mouth. 6. Now come back. You're going to keep all 4 probes on the face and glide gently to the left for 6 beeps. Excellent. You're going to go under the mouth, under the lips, right underneath, and you're going to do the same move to the right for 6. And the 6th one, turn up and make her smile. And hold. And back to the center, and the same thing to the left. Val, I think you're a natural. So get your hands comfortable. You might want to hold them, like pencils, because it's easier to control.
Oh, okay.
Okay?
Yeah.
And you're going to move for 6. Now you go on both sides of the mouth. So you're going to go to the right. There you go. Very good. Here. Start in the middle. Start in the middle. And then just from the glide to the base of the chin and to the bottom of the lip. 6. And go to the right side. And start in the middle.
Oh, sorry.
That's okay. And glide for 6.
Here. And
you're going to purse the bottom lip together. It's a lip purse. It gets all those little fine lines. And
is that?
Yeah, I would prefer you ask your client to relax her lip and purse like a pouting child.
Okay.
5. And that's enough. 5 on there. That's your transition. Now you're going to come over to the right side of the face, and you're going to continue addressing those little lines, and you're going to press down. It's nothing except a very gentle, evenly pressured pressing at the side of the mouth. Okay?
Mm-hmm. Pressing down or
Pressing
towards one
down,
another?
not towards, just
Okay.
down, because you'll see. Feel it and down. Do you see how that puffs up the whole
Yeah.
side of the mouth? Place it under the chin, and you're going to just bunch up and create a bunch under. There you go. Perfect.
Is that
Perfect.
feeling
I think you're a
okay?
natural, Val.
Mm-hmm.
And 5. Now you're going to move up this
Oh, okay.
muscle.
Right.
Remember, Val, after you've gone through the face today, you'll go over and you'll look over your manual and it will come back to you. So it's a good idea after. I prefer that you bring this up more.
Oh,
Remember,
okay.
it's a face lift. So you see how individual this is. Everybody has a different way of learning. Some people learn slowly. Some people aren't used to touching faces. You don't have to be an esthetician. You don't have to have experience in this. All you have to do is have a desire to be in a very exciting anti-aging business. So, very good. This is very good. This is why you're going to get 12 different faces. Every facial contour is different. You have to follow the contours of every face.
Mm-hmm.
So when you do, you'll see some people have more fatty tissue in their skin, firmer skin. Some people don't look like they have any muscles in their face at all. So it's a different experience for every face you're learning on, right? That's why I like 12 different faces. And you have to have 12 treatments to complete one whole series, and that's where you get your initial lift from. Okay, Val, so you finished 2 rounds. You finished preparation and you finished toning and lifting on Jeannie's face, and now we're going to go into feathering. So feathering exfoliates the skin, it addresses deep lines, and it addresses fine lines. This is working in the dermis of the skin. This isn't going down into the muscular level. This is where that face gets to be shined and it starts to get that glow from feathering. Turn your dial to F1. Your frequency dial will go over to F1 and your microcurrent goes up to 220. Okay? In this treatment, there's a lot of bouncing currents and frequencies. This is where the surprise of the little electrical stimulation starts to stimulate the skin. Okay? This is where you can really address the lines, the wrinkles. This is good for acne. This is good for rosacea. This is good for a lot of other dermatitis type issue related. It's safe, okay? So I want you to feel comfortable. I want you to wet your probes. And remember, the machine will go off if it's not used in 90 seconds. So that's a really nice benefit of this machine. It runs on batteries and it runs on electricity. So if the electricity or there is ever a power outage, the batteries will kick right in. So if you're not using your machine for 90 seconds, it automatically goes off, so there's no waste of power. Okay, so you're going to start again, dip into your collagen correction, and this is great because you're stimulating collagen from the inside and you're also driving it in externally. So it's a double dose of collagen, okay? So you're going to start using both probes, holding them no more than an inch apart, and you're going to start feathering. You can use bigger strokes, that's right. There are so many ways to address feathering. So you just want to make sure you're This goes over your shoulder so it doesn't go on your clients. Little things, right? Little things. Even I forget sometimes. I get really excited about getting rid of a wrinkle on somebody or getting that face to shine, and all of a sudden I forget that they're even there. So you want to use larger strokes sometimes, especially when you're going down to the neck. Now, when you're using, go ahead, you have a question for me?
Well, I'm sensing that these could use a little more moisture.
That's what I was just going to tell you. Okay, very good, Val. So you always want to make sure your probes are moist and have enough collagen on them. So especially in larger areas like the neck and the décolleté, normally we would ask clients to remove their jewelry, and if they'd like, they can take off their top so you can address the décolleté and the neck area. But you can sometimes move the probes going hither and yon.
It's interesting from this perspective. I can really see the blood and the aliveness coming up into the skin very quickly.
Well seen, well seen. And it's interesting also. Keep, you know, it's time.
Okay,
these treatments should take an hour. When you're first learning and you're first starting, it will take maybe a little bit longer, but the idea is 1 hour per treatment. Remember, your client has places to go and you have more clients to see. All right, so it's more of a glide. There you go. And they don't have to be so close together. They can be a little bit apart. Let them move together. Remember, all 4 probes are on the face at all times. And remember, it's a rubbing, it's an erasing, it's a feathering. It's gentle, even pressure. There you go. Everybody has their own style for feathering. So you just want to make sure. There you go. And it's often interesting that you'll notice after a few treatments on the same client that you'll see that you'll touch the probes in one area and the whole face comes alive. Very interesting. Yeah. So now you've done some feathering in the exfoliating session. So now you're going to move the dial to F2. And remember that you always have your treatment settings on this card. So now you're going to start addressing deep lines. So you're going to move your microcurrent, back to 140. And you're going to dip into some collagen. And you're going to get started addressing deep lines. So
she doesn't have very many.
Well, that's okay, and she never will if she continues with her microcurrent treatments regularly. After 12 treatments, Val, your client will come back no less than once a month. You can be a little faster in this. Now, I want you to start to get the confidence, because this is so safe, you can go around the eyes. Under the brow, lifting it up. Under the eyelashes. Do you know the muscle goes right up to the lashes? And you can move as quickly and as confidently as allowed. And you're going to go under. Jeannie, are you comfortable?
Yeah.
I have been doing this for 13 years, and I still ask my clients if they're comfortable.